Hi, I'm Dr. Doyle, and I would like to take a few minutes to speak with you about a common disorder that affects a large number of patients called cervical dysplasia, or precancerous changes of the cervix. The cervix is the lowest portion of the uterus that opens into the vagina. At some point in our lives, we may be exposed to an infection with HPV, or human papillomavirus, which is the most common sexually transmitted infection in the world. If this occurs, the infection can result in cervical dysplasia, which is usually detected on a pap smear. When cervical dysplasia or an HPV infection is found, we may simply repeat your pap smear in 3 to 6 months, or we may perform colposcopy, where we look at the cervix and vagina with a lighted microscope. Sometimes during this test, a small biopsy may be taken, and this occurs in a regular appointment time. The results of this test help us determine how to take care of the dysplasia. While prevention is available by vaccination with one of the HPV vaccines, there is no treatment for the viral infection. Fortunately, the body will usually take care of this infection over time. It's very important to follow up with these changes because cervical dysplasia can lead to cervical cancer. Also, there's a strong association between HPV, cigarette smoking, and cervical cancer, so please don't smoke. If you would like to learn more about cervical dysplasia, text HPV to 74455 to view our expert video about this interesting and extremely common problem. Of course, if you have any additional questions about cervical dysplasia or one of the HPV vaccines, please feel free to discuss these with me or one of my colleagues during your visit.